Good afternoon. Good afternoon, distinguished colleagues. A very warm welcome. Hello, hello. Welcome to those who joined us from various places in Ukraine and worldwide. I can see some familiar faces. I'm delighted to see you. I'm here today to welcome you to the first webinar. This webinar is about URISE project. My name is Iryna Frankova. I am a medical doctor, a psychologist, a psychotherapist from Ukraine. Currently, I'm affiliated with two universities, National Bohomolets Medical University in the city of Kyiv and also Vrije Amsterdam University in the Netherlands. Thanks to this combination, I could invite the colleagues from Ukraine and from Europe today. I would like to introduce this initiative to your attention. It's a mental health and psychosocial support initiative supporting the Ukrainian in the EU countries. Before we start, I wanted to ask you to mute yourselves if you're not speaking currently. However, please feel free to unmute yourself and to ask questions, also provide your feedback and comments, and to actively participate in this meeting. As I've already mentioned, it's a recent project. This is webinar 1, and today it's an introductory session. We are meeting the participants of the project itself. These are the people who will be in charge of the main activities. We will also meet mental health professionals from Ukraine who found themselves in Europe. And they are willing and would like to and have the energy to assist our compatriots and to provide them with mental health support. Therefore, this meeting will enable you to listen to the introductory session about the actual project, training activities, and some information, as they say, from field work, from colleagues from Netherlands, colleagues who are currently working in Poland would be presented to you from all those creating capabilities for psychosocial support right now. I invite you to put your questions in the chat. There would be a Q&A session after each presentation, and we will conclude with the general discussion. This webinar will be recorded. Two recordings would be available in the English language and in the Ukrainian language. Therefore, after this webinar is over, you could share the recording with those who might be interested. Regarding the interpretation, in order to hear the interpreted version of the webinar, you need to select the right language channel.
Please use the interpretation button on the bottom.
Iryna provides the instructions for those who are using the wrong channel. You need to press the globe sign and choose English or Ukrainian channel. Once again, to enable interpretation, press the globe icon below in the black bar and select either English or Ukrainian channels. Okay, looks like we're all set, which means we can start with the first speaker. I am delighted to welcome here a colleague of mine, Els van der Ven, and she's a URISE coordinator She is an assistant professor and works in the Department of Clinical Neuro and Developmental Psychology of Vrije Universiteit Amsterdam. She is also a global mental health researcher. She is also a clinical psychologist involved in clinical work at our ARQ National Psychotrauma Center in the Netherlands. Els, the floor is yours. Please introduce the project to this audience we have today.
Thank you, Iryna. Thank you for this kind introduction. And I'm very excited to see all of you here for this first URISE webinar. So let me share my slides. Okay, so today I'll be introducing the URISE project. And URISE stands for Ukraine's Displaced People in the EU. Reach out, implement, scale up, and evaluate interventions promoting mental well-being. This is an EU funded project. And I'll be talking today about different topics within URISE. So first, I will give you an overview of the partners and the countries. Then I'll be going over an overview of the activities that we're planning to do within URISE. I will be talking about the capacity building activities. I will give you a timeline of the URISE project, and then I'll end with some conclusions and give you some space for questions and suggestions. So first of all, URISE is a project that was funded within the EU for Health program. And the EU for Health program is a program within the EU, which was created as a response to the COVID-19 pandemic. And it's an unprecedented commitment to foster health in Europe, in which the EU has made substantial financial investments. And within the EU for Health program, last May, they started this call. It is a new call for mental health assistance for Ukrainian refugees. The target population of that call included Ukrainian and Russian-speaking health professionals, displaced people from Ukraine, and the type of activities that the EU for Health program wanted to fund included the exchange and implementation of best practices to increase awareness, knowledge sharing, and support, and to implement evidence-based actions such as psychological interventions. And the target locations that the EU included in their call were mainly Ukrainian or mainly the bordering countries of Ukraine. So this was last May, and we started to develop this project that in the end got funded. And within the URISE project, we have several different partners from different regions. So we have FONIO, which is an NGO in Romania. We have ARC National Psychotrauma Center, which is in the Netherlands, and they're specialized in the implementation of psychological interventions. We have Telenet, which is a local NGO from Slovakia. The University of Verona, which is a WHO collaborating center. We have International Medical Corps, who also will be presenting today, and the University of Luxembourg. And here is just a group, several of our collaborators. And within the URISE projects, we aim to implement face-to-face interventions and digital interventions. And the face-to-face interventions that we are planning to implement will be targeted at displaced people of Ukraine in Poland, Slovakia, and Romania. So what is URISE's vision? Well, the vision of URISE is focused on the support of the displaced people of Ukraine by, first of all, optimizing the MHPSS response and improving the accessibility of mental health services. So what we see right now is that there aren't enough services in Ukraine's bordering countries, but we also see that often people experience long pathways to care, and there's just simply also a lack of knowledge of where to get the right services. Second of all, within URISE, we want to build sustainable capacity and implement effective evidence-based interventions. So we really want to make an impact that goes beyond the duration of the project. URISE is a 2-year project, and we want to make sure that we build capacity that is effective for the longer term. And then third of all, we want to have active involvement of relevant stakeholders. So this includes international organizations like WHO and Red Cross, but also people from the community, mental health workers, displaced people of Ukraine, to hear what are their unmet needs. So the Vrije Universiteit Amsterdam is the URISE coordinator, and the VU is a WHO collaborating center with a long history of developing and evaluating scalable psychological interventions. By doing so, we're also contributing to the WHO guideline development. So one example of a successful collaboration between the VU and the WHO, you see here on the right. We have collaborated with WHO to launch the Doing What Matters in Times of Stress app in Ukraine, which is now available. And we're within URISE, our goal is also to make sure that more people are going to be using these apps and that it becomes more accessible. We have had Ukrainian expertise as part of the project development. So right when we started developing URISE last May, we had a lot of people, like input from people of Ukraine, including Iryna, who you've just, who is the leader of this webinar, but also some other key people. Then the VU has a strong network for coordinating capacity building and implementation of WHO interventions. And that's also because the VU is a coordinator of other large-scale EU projects, such as the Strengths Project, the Skills Project, and Respond. So to give you an example, the Strengths Project is a very large EU project that is focused on providing psychological interventions for refugees from Syria. And Respond is a project that focuses on the consequences of the COVID-19 pandemic and how to implement scalable interventions to target vulnerable groups. So we were very excited, of course, that our URISE project received funding from the EU. And what are the type of activities that we are planning to do? I'm going to say right away, I'm going to be very honest with you, it's a 2-year project and we're extremely ambitious. So it's going to be a lot of work the coming 2 years, but also we have a lot of exciting activities that we want to implement. So these include digital interventions to improve mental well-being. These digital interventions include the psychological first aid chatbot, which was co-developed by Iryna. This is a Telegram-based chatbot that sends messages based on psychological first aid interventions. And the other intervention is what I just mentioned, so Doing What Matters in Times of Stress, which is a digital intervention developed by the WHO. Another important component of the URISE project include face-to-face step care interventions to reduce stress and build resilience in Ukraine's displaced people. We have several WHO interventions that we aim to implement, which include Self-Help Plus and PM Plus, so Problem Management Plus and Self-Help Plus. Then we have a third intervention, which can be seen as a add-on interventions that's called the multi-family approach. And this is an intervention that it targets families and has a kind of system-based approach where you really try to target the system of not only the individual but their loved ones. Then another component of the URISE project is that we want to build capacity for sustainable based and promising mental health interventions in these three countries, Poland, Romania, and Slovakia. I would just like to mention here that for the face-to-face interventions, we targeted these specific countries because they receive very high amount of displaced people from Ukraine. However, we also included these digital interventions because their reach is much higher. So we can, by kind of combining these digital interventions with face-to-face interventions, we kind of hope to maximize our reach. And a fourth component of intervention of activities within URISE include the creation of a European network of Ukrainian and Russian-speaking mental health professionals and other stakeholders in the MHPSS response. So there are already several networks, local networks that have been created, and we are now aiming to kind of unite these networks and make sure that we can facilitate collaboration across countries and across target groups. So an important part of the URISE is the implementation of different interventions. And here, this pyramid basically reflects the intensity of care that people might need. So very, like at the bottom, you see basic services and security. Then we have community and family support. So the psychological first aid chatbot and the Doing What Matters in Times of Stress app, these interventions, they target this kind of level of support that people might need. Then if some people may have like more serious psychological problems, they need focused person-to-person non-specialized support. And this is where interventions such as Self-Help Plus and then PM Plus and multifamily approach, they might be a good fit. Then I would say Self-Help Plus is a low intensity psychological interventions, which is given in groups. So it's face-to-face, but it's still in a group setting. Then we have multifamily approach, which is only when you have a few families that can be given the same interventions. A lot about sharing experiences. How do you manage stress, and how can you provide support to each other in times of stress? And then one intensity higher in terms of psychological support is the PM Plus, which is a face-to-face, one-on-one psychological intervention. And then there's a group that will need more specialized services. And within this project, we are going to make a roadmap of specialized services in the countries that we are targeting. So in Poland, Slovakia, and Romania, to kind of make sure that we have those places where specialized services are offered, that we can identify them and make sure that we accelerate the referral pathways to appropriate services. So to give you an overview of the type of work packages that we have within URISE, first of all, we are in charge of the coordination of the project. Then we have work package 2, which is focused on the dissemination and the communication of the project, which is led by Vitaly Klimchuk from the University of Luxembourg. Then we have work package 3, which is focused on networking and raising awareness, which is led by Iryna Frankova. Then we have work package 4, which is focused on capacity building, so training of trainers and training of helpers, which is led by IMC. Then we have work package 5, which is focused on the implementation and the evaluation of face-to-face interventions, which is led by the University of Verona. And then we have work package 6, which includes implementation and evaluation of digital interventions, which is led by Telenet, which is the NGO in Slovakia. So this is what our training pyramid looks like for the capacity building. This is the training pyramid for PM Plus and Self-Help Plus. So right at the top, you see the PM Plus, Self-Help Plus master trainings. Those will be training psychologists, mental health workers. Then they will provide training and supervision of peer helpers. And the peer helpers will provide PM Plus and the Self-Help Plus interventions to the displaced people of Ukraine that need mental health support. So this is a little bit of a busy slide, but I'll walk you through it. This is what the timeline looks like for the URISE project. So here you can see work package 2, which is the dissemination and the communication work package. And at the top, you see the months. So we only have 2 years for this project. And in the beginning of the project, we will be, spreading information on websites and social media. So right here at the bottom, you see we have some press coverage. We have like LinkedIn page, we have a Pure page, we have Facebook. So we're really trying to get the word out that we're starting the project and to attract people that are interested to join the project, to be part of this project. So this is also a kind of message to all of you that you are very welcome and free to disseminate all these materials and to spread the word, let people know that we're doing this, because we really want to make this a bottom-up effort where we're really working with the people that are looking for psychological services. We're also in the process of identifying and engaging different stakeholders. So these stakeholders include people displaced people of Ukraine, but also local NGOs, international organizations, organizations that have psychologists who want to be trained. So there are multiple levels of stakeholders involved. We're working on our communication and dissemination plan, and on the dissemination of training materials. This is also, it's also our goal to make training materials as available as possible. So we're going to be sharing that as well. Yeah, so this work package is in the beginning, the first months, it's really about increasing the visibility of URISE. Then we have work package 3, which is really focused on networking, raising awareness. So this webinar is part of that. And in the work package 3 is also where towards the end of the project, we will be creating this roadmap in which we are identifying specialized mental health services. Then we have work package 4. This is the capacity building work package. So as you can see, we are going to be towards the second half of this year, we're going to be training psychologists, mental health workers to train in Self-Help Plus and PM Plus. And we're also going to be training in the multi-family approach group. Another important component of the capacity building is not only the training of the trainers, but to also make sure that there's supervision. So the people who are going to be training the helpers, they need to also provide supervision to the helpers. And there's also an important quality assurance component, and we're using a WHO platform to assess the quality assurance called EQUIP. Then we have work package 5, which is includes the implementation and evaluation of face-to-face interventions. We're going to be doing a needs assessment among service providers and beneficiaries. And we're going to be also doing some outcome assessments. These are going to be assessed digitally. So we really want to kind of just with some basic tools, just track their mental health. And it's important to mention that this is really an implementation project, but we still want to also collect some data for research. And then lastly, we have the work package 6, which tracks the implementation and evaluation of the digital interventions. So also for the digital interventions, we'll be doing a needs assessment of service providers and beneficiaries, and do an outcome assessment to see whether people do a pre and a post intervention measure to see if people benefited from the digital interventions that they received. So just to close with some conclusions, URISE is a collaborative bottom-up effort to improve the mental well-being of the displaced people of Ukraine. As I've mentioned, we're really looking for collaborations, for making sure that we also listen to the suggestions that are coming from the community. There are a lot of important topics for which we need input from the community. Think about stigma, think about how to reach people, how to reach those people that for which the need is greatest. So there are a lot of kind of still possible bottlenecks for which we are looking for input from you. So URISE is a multi-layered approach. And by that, I mean that we are trying to kind of include different types of interventions to maximize our reach. So we're using digital interventions, face-to-face interventions, both targeting kind of very low threshold mental health problems and also more serious mental health or severe mental health problems. Capacity building and ongoing supervision is a very important component of URISE, and it will also be a very important component for its success. And our overarching aim is to positively impact the community and share best practices, not only until the end of the project, but to well beyond. So thank you so much for your attention. I'm happy to take any questions or suggestions.
Дякую, Елс. Дякую дуже, що ви поділилися.
Thank you, Els. Thank you for sharing this overview of the project. If you could please stop sharing the screen so that we could see all of the participants. And we would like to listen to your questions or suggestions. Please raise your hand to ask a question by unmuting, or you can write your question on the chat. I have already seen some questions on the chat, and while you're still thinking about your questions and writing them, maybe I would like to express my gratitude to Els again for presenting the project, for providing us with the overview, because Ukraine has been recently included into the eligible countries to apply for the EU grants. And when we were writing this proposal, Ukraine was not yet part of the eligible parties. That's why we were not able to engage Ukraine to implement the interventions. However, Ukraine actually is a very fruitful ground for the active promotion of these interventions for the PM Plus and others. So we are keeping track and we are not behind. I know that the medical corps colleagues who are working on the implementation of these approaches we have already collaborated with them. So since Ukraine already is eligible to apply for these grants for the future, that could be a very good idea. And I believe this project could be a very good case, an example of how this could look like. So we have a question, several questions. For example, who of the researchers from Verona is personally engaged in the project? So I already provided the answer. This is Mariana Purgato and Professor Corrado Barbui, and there is an entire team with them. Also, there were some questions about whether the training could be taken in the Netherlands. What do you say else? What is the general answer that we could provide to our participants about other countries?
Yeah, so although we would really like to give training to as many people as possible, I think it's also important to mention that there are a kind of maximum amount of people per training. So I think that Sam, who is going to be presenting after me, is going to give some information on that. So as long as you're able to implement these interventions in the country, in the target countries, I think that that would be possible. But if you're based in the Netherlands, then I think that it might not be ideal. So I guess my response to the question is, it depends a bit where you're based. If you're based in Poland, Romania, and Slovakia, that will be possible. Otherwise, I think we have to prioritize the mental health workers who are working in these areas.
Так, дякую, Елс. Дійсно.
Thank you, Els. Yes, indeed. I am certain that we have colleagues from Ukraine here during this event, but they are staying in other countries, in Europe or elsewhere in the world. And the case that we are trying to present today might become the driving force to promote similar activities in Ukraine. Because as far as the Netherlands, we are implementing a similar action, including the PM Plus and other approaches. As a matter of fact, the initiative should come from the people who need the care and support, and also it should come from the community and from the state to organize this initiative. But your question also highlights the importance of this need. I can see some other questions on the chat and two hands raised. So, Jock Prince, you raised your hand. The floor is yours. Unmute.
Hello.
Hi.
Hi. Yes, it was my question of the trainer in the Netherlands, because I am a social worker and I work with Ukrainian refugees, and I think for them it's very good to have the program of the Self-Help Plus, for example. But I want to do the training so I can help them with that, and I can help the people who want. I know there's a social worker, and I think it's for her it's very good also to train the other people there. So I could not find anyone in the Netherlands who can train me for doing for training them. Is there any possibility?
Дякую за ваше питання. Я надіслала.
Thank you for your question. I just copied my email on the chat. Maybe you could write to me directly with your request, and we will try to find the people who are doing the same thing in the Netherlands. So we will try to understand what could be feasible and possible. Please write to me. Katarina Berezina, you have a question. I am Katarina Berezina. Good afternoon. I am a psychologist from Ukraine, but I'm currently based in Slovakia. In the beginning of the year, when I came to Slovakia because of the war. I worked together with the NGO who are based in Slovakia, and they were working with the Ukrainian refugees. It was a short-term project last year. It didn't have much funding, and now the project is over. And I would like to apply to be able to work with the refugees from Ukraine because I already have certain experience and I have certain ideas because I already saw some of the primary requests. They were mostly about the everyday needs that they needed to cover. And with our colleagues from Slovakia, we are trying to provide the first psychological aid. And many people, especially the older age people, they didn't respond to that. They were not interested. They would rather be interested where to get the money or the doctors, for example. Of course, it's all very understandable, very much understandable and clear, but thank you, Katarina, for raising this issue. Yes, indeed, during this webinar, we have the participants who are either interested to take the training of trainers, to become the trainers for other helpers, to provide care, or they might want to become the helper who would take this training conducted by Ukrainian-speaking trainers. So today we have a very good bridge. Now we're going to listen to our colleagues from IMC and who will tell us more about how this is implemented. And all of those colleagues who already work in the specialized facilities or institutions in those countries or in some NGOs, they might already be providing this support and care. We also need you very much. We encourage you to join us to develop these roadmaps for those who require the specialized training and the professional response to their requests. And now Sam will tell us more about how to apply. And also I need to mention that this webinar is being recorded and all of the participants who registered for this webinar will receive the invitation and our mail outs. And we will be notifying you about the activities we run, about the requests or questions, or who we invite to speak, or how to provide feedback, etc. So all of this information will be shared to you very soon. And there is the last question from the chat, which is extremely important to raise from Ola Kaczynska, but I would like to keep it and postpone for the general discussion because it's about the project in general. And now, if you do not mind, I would like to pass the floor to our next speaker. And this is the colleague who is currently working at IMC, which is the international NGO, International Medical Corps in Poland. And actually, Nosheen will be able to share with us about the activities that they are doing as IMC for Ukrainian people, not only as part of this project, but also as part of other efforts. And also she will tell us more about the role of IMC in that project. And my colleague is the expert in the area of mental health and psychological support. And she is also the expert in the gender-based violence. She is the psychologist, and she also participated in the management of the working groups in response to the crisis related to the war and other types of crises in South Sudan, in Pakistan, in Nigeria, in Tajikistan, Uzbekistan, Yemen, Iraq, Ukraine, Moldova, and Poland. So, Nosheen, we are happy to listen to you.
Thank you, Iryna. Thank you so much. My name is Nosheen Kashif, and I'm working with International Medical Corps as a mental health and psychosocial support coordinator here in Poland. As Els mentioned that IMC, sorry, I will be using abbreviation instead of like taking the full name for International Medical Corps. So IMC is actually on the work package 4, and we are focusing on the capacity strengthening in the URISE project. IMC has a long presence in this region, particularly in Ukraine. So in Ukraine that we started response in 2014, and 2014 onward, IMC was having like a full presence in Ukraine in different sector, in health protection, child protection, and mental health, cash, and some nutrition program. In the current situation, IMC still have a very vast response in Ukraine, and also in Poland right after the crisis started last year. So we started the response in Poland as well, as there was a huge number of refugees coming, both like Ukrainian refugees and also third country national. So IMC started response in Poland as well, and we were working mainly in protection sector, in health sector, and the mental health sector as well. We did a series of training on psychological first aid, the TOTs that we provided, and luckily, I have my colleague today with us who was at that time with IMC, who provided the TOTs on the psychological first aid and also the post-training supervision that was provided to the first line responders. So like we have a long presence in IMC, and in 2023, we are mainly focusing on capacity strengthening and also the post-training supervision, which is our main vision for 2023. And this is not only on the URISE project, but also in our other project, we have a series of training. My colleague Sam will explain more about what training we are planning, especially under the URISE, and when these trainings are planned, because we have now a full schedule of face-to-face training in Poland, that we have multiple dates available for these training on Self-Help Plus and PM Plus. So the registration link will also be shared. I know a lot of participants, they have questions regarding the training, so I can talk more about the Poland, when are the dates available and who can apply. We have a criteria. Sam can explain about the trainings in detail and then how we can apply. In the chat box, we will also share the link for the registration. So those who are in Poland, or those who know that there are the mental health professionals and social workers who want to participate in these training, who are actually closely working with the Ukrainian and third country national refugees. So it will be very, a pleasure for us to have these people for this series of our training. So I will leave the floor to Sam, who can explain more about what is Self-Help Plus and what is Problem Management Plus. And also he can briefly talk about IMC experience that we did on psychological first aid last year with the first line responders. Sam.
Thank you, Nosheen. Thank you, Iryna and Els. And thank you, everyone, for joining us today. I'm very excited for the URISE project, as all of us, I think. And so I want to give you a context about, like my colleague Nosheen mentioned, about the presence of IMC in Poland and Ukraine since March 2022. We have implemented a series of training of trainers in psychological first aid that followed a rapid needs assessment in both Poland and Ukraine that targeted service providers and also displaced populations in multiple cities across Poland and on the border in Ukraine. So to address those needs, it was highlighted that psychological first aid was very needed amongst volunteers specifically, and amongst service providers and frontliners, providing help and in direct contact with refugees. So we implemented a series of training of trainers. The target was Ukrainian and Polish, from mental health professionals to service providers to volunteers. We supported also, so we implemented the trainings in multiple cities in Poland and in Ukraine, and we provided also supervision and support following the training to help the new trainers roll out their trainings and reach more and more people and reach more volunteers and service providers. And we helped with the adaptation and translation of training materials, preparing like a nice package and a helpful package of tools for the new trainers to roll out their trainings and go further. And that was very successful throughout 2022. And now it's, of course, a different phase. We are trying to assess also needs now that a lot of displaced people have stayed in Poland or have settled in Poland and in the neighboring also countries. So assessing the needs, we found and works great with the EURISE project that scalable interventions, psychological scalable interventions are very much needed because of the pressure that has been created also on the mental health services and on the specialists also, like to reach, for people in need to reach a psychologist or a specialist to seek for help. So I will share with you just our action points. And I will give a brief overview about the trainings and what will the trainings be about. So if you have any questions, please.
Sam, Sam, можливо, перед тим, як ви
Sam, maybe before you continue with the trainings, I would like to introduce you to our audience. We have heard already that you're an experienced trainer and that last September you visited Ukraine and you visited Poland and that you trained on the first psychological aid. And this project, an IMC project, and basically Sam was invited to become a PM Plus and a Self-Help Plus trainer. It's important. Well, actually, Sam is my trainer. He's the person who taught PM Plus to me. We have attended this training in the Netherlands in September 2022, and this weekend I gave my first training for the helpers. It's ended now and we moved to the supervision stage. My background is medical. I'm a medical doctor. I'm a psychotherapist. I'm a trauma specialist, but in a situation where many of us, and we saw persons who had to flee the country, what they need is not trauma therapy, but they require psychosocial support. And I think this is the beauty of the intervention. So, Sam Hunaidy is a trainer in multiple interventions. Intervention related to gender-based violence, related to trauma-informed approach. He worked in various situations and various settings, and maybe Sam, you could mention where else you worked. And he has 10-year experience in running the training sessions. This first critical period when the crisis is just unfolding and you're in charge of ensuring the trainings. Okay, thank you. Sorry that I interrupted you.
Thank you, Iryna. No, of course, I forgot to introduce myself also, so thank you for that. I immediately jumped in to talk. So yes, just following what Iryna was saying, I have been working as a mental health and psychosocial support trainer and also in protection mainstreaming for the past 10 years in Europe and in the Middle East and in North Africa, focusing on the mental health and psychosocial support needs of displaced populations and refugees. And often after a crisis, we always notice that what a lot of people, a lot of mental health professionals try to help in providing, like Iryna said, in providing trauma interventions. But a lot of times we notice and we see that what people need is psychosocial support, is multiple forms of low intensity psychosocial support to help them move on and or to help them cope currently with the challenges they are facing. So I have been training on Problem Management Plus and Self-Help Plus as well, and I have seen a lot of promising after supervising also the helpers and the facilitators. I've seen many promising results of people being really supported and satisfied with the services they received. So I'm very excited to share the interventions with you today. I hope you can see my screen. So as part of the URISE project, IMC will be as Els presented. IMC will be implementing the capacity building work package in Poland and in Slovakia and Romania. And this capacity building, so we want to engage basically in capacity building for local community, for organizations, for also community members to implement low intensity psychological interventions like PM Plus and Self-Help Plus. And we will do that through conducting trainings of trainers and helping also the trainers, the new trainers, implement the trainings, reaching out more and more service providers. We are aiming, of course, to train mental health professionals because to be master trainers and to be also supervisors. We will also help with adaptation. So we are in the process of finalizing adaptation of materials, translating the manuals and the training packages, and preparing a set of tools for the trainers to help them along the way. So we also will provide bi-weekly supervision throughout the year, starting after the training until the end of the year for all the new trainers to help with implementation and of trainings, and also with their supervision of helpers that they train. To ensure the quality of the services provided, so we will use the EQUIP platform, which is ensuring quality and psychological support. That is also in a partnership with WHO and with UNICEF. And it's to ensure to help also the helpers that are providing PM Plus and Self-Help Plus also check their own quality and develop also during supervision. So this is just to give you an overview of what Problem Management Plus is. So Problem Management Plus is an evidence-based low-intensity psychological intervention. It was developed by WHO a few years ago, and it is developed for adults impaired by distress in communities that are exposed to adversities. So the PM Plus has been implemented in multiple areas across the world, in Asia, in the Middle East, in North Africa, in Europe, and it has been shown to reduce symptoms of common mental health disorders. It aims, so one second. I'm having, okay. So yes, so I was also part of the research project, which is Strengths, that Els also mentioned, my colleague, which was a huge research and implementation project that investigated the efficacy of Problem Management Plus on reducing symptoms of common mental disorders. And the result was that PM Plus was effective, was actually quite significantly effective in reducing those symptoms amongst Syrian refugees. After strengths and after, let's say, the release of results of strengths, PM Plus has been also implemented in the Netherlands as part of the health services, and has been really successful. I had the pleasure to train and supervise mental health specialists who are providing the intervention in the Netherlands. And I will tell you also about Self-Help Plus. So Self-Help Plus is also a brief guided self-help psychological intervention. It aims also to reduce stress and improve the overall well-being in adults. So Self-Help Plus is a group intervention. It's 5 sessions of stress management course. It aims for large groups between 10 to 30 people, and it is delivered usually by a trained and supervised non-mental health specialists. Self-Help Plus also uses like a audio guided exercises, stress management exercises and grounding exercises. And it basically is based on acceptance and commitment therapy, and it which emphasizes learning new ways to cope, accommodate difficult feelings and thoughts, and also for people to live with their own values. Also, SH Plus has been shown to reduce psychological distress, prevent the onset of mental disorders. So both trainings, sorry, I forgot to mention something about Problem Management Plus, which is, so Problem Management Plus is also a 5-session intervention, and it's done individually. So there are multiple formats of it. There are formats, group format and application digital format, but we are implementing the individual format, which is one-on-one, in person, face-to-face, and it's a 5-session intervention. Each session ranges like around 90 minutes. In those sessions, of course, the helper teaches the clients strategies that help them deal with psychological difficulties, like, for example, fear, feelings of helplessness, and sadness, etc. But also it addresses practical problems, and like, for example, conflict within family members, livelihood problems, and so on. So yeah, so that is for PM Plus. So both trainings in general, so the training of trainers in PM Plus and in Self-Help Plus is an immersive experience training. So it's about experiential learning. It includes a lot of discussions, a lot of role plays, feedback, observation, and life practice. And yeah, we aim that all the new trainers gain in-depth knowledge, of course, of the interventions themselves and the strategies and how they work, but also in the methodology of training lay professionals in delivering PM Plus and SH Plus to other people. The training also will include supervision components, because the new trainers will also support those they train in throughout the way by supervising them when they implement PM Plus and SH Plus. Our team also will be helping supervising the new trainers in their trainings, but also in their supervision. So in Poland, so with the URISE, we have 2 trainings that are already scheduled in Warsaw. The PM Plus TOT is planned on 20th of March. And I'm sharing the registration form. We can share it later with everyone. And for SH Plus TOT, it's for the 24th of April. And we have another, like in the registration form, you'll see different trainings. So because we have other projects as well, we are implementing for IMC, and they also include trainings on PM Plus and SH Plus. So there will be a variety of options for people to choose from. But for the training of trainers, again, we are targeting mental health professionals, Ukrainian speaking, specifically mental health professionals, because we prefer that PM Plus and SH Plus is delivered within in the same language of the people that are receiving it. It actually helps with the barriers, and it helps with building trust as well. So this is a brief overview of the trainings and of the interventions and of our activities. So please, if you have questions, let me know.
Дякую всім. Я щойно
Thank you,
поділила
Sam. I have just put these 2 links in the chat,
з вашого дозволу.
if you don't mind. So,
Thank you.
if I understood you correctly, well, I have some knowledge of how this program is implemented. So the first phase is that a limited number of trainers are taught, and it would be helpful if these trainers also spoke English. Is that right? Because some part will be rendered into Ukrainian, and some training will be taught in English. And then these trainers will train the helpers in Ukrainian. They will deliver this training in Ukraine, and helpers will deliver this intervention for people from Ukraine as part of their routine work, or if they work for an NGO, for example, or if they have a private practice, or if, and I know from my experience, people who work in Ukrainian locations, and they see the need and the opportunity to provide psychosocial support. Did I understand you correctly?
Thank you, Iryna. Yes, so that is true. So the first phase is we are training the mental health professionals, Ukrainian mental health professionals. So we try to seek people like who have a foundation of English or have a basic knowledge of English. However, in the training, so to make it easy, because it's also a pity to we feel always that narrows down the opportunities for a lot of professionals that are working so hard and are very motivated to attend the trainings and to provide these services, just because their English, let's say, is not compatible or not in a level where they can understand the whole training. So we are providing simultaneous translation from English to Ukrainian in the training. So so I will be speaking in English, and there will be, of course, the headsets and a cabin translator that will be providing the translation to Ukrainian. So in this way, it's not required for the attendees to speak English. In supervision sessions, we will have our colleagues who are also Ukrainian interpreters. So in supervision also that will follow the training, we will have support for the language. So it's also not required to have, let's say, a fluent level of English to be able to attend the training. So we would like to invite actually anyone who is interested. And then in the second phase, after the training is finished, we will help every trainer set up their own training. Their first training, they can do it in pairs or they can do it individually. And I will be present in their trainings to support and provide any help if needed for their training, so they can also carry on and roll out more and more training.
І я ось зразу бачу коментар щодо того, що ви
I can
зазначили,
see
що
the comment about what you just said, saying thank you for caring about the experts who have some issues with English, but nevertheless, they have the huge practical experience. As far as I understand, this is the focus. It is good when the trainers have the in-depth background, either clinical or psychotherapy, or maybe teaching background would be an asset, or conducting trainings background. But the helpers do not need to have the background in a psychological area, but they need to be the leaders in their communities and they need to be ready to provide that help and care.
Yes, that is true. So the helpers, that is so true actually, and also for the trainings, we are also, this is what I meant with adaptation. So to help the new trainers also carry out training and supervision, we are in the process of adapting the materials, translating it to Ukrainian, also creating like adapting, sorry. Trainer manuals that will help them guide their trainings, and a whole package. So they will have all the tools in their own language, which will be very helpful instead of having to navigate through the English manuals and set of tools as well. In terms of helpers, so the helpers, we ask helpers, helpers don't have to be mental health specialists, so we say non-specialists. However, we ask that they have some kind of experience in social work, in education, in health, so they have also some foundation of working with people. So to help, for helpers to be trained and supervised afterwards to provide PM Plus and SH Plus.
Дякую, Сем. І
Thank
дякую
you,
за те,
Sam, for explaining, and also thank you for sharing the experience. And now I suggest that we move on to our final speaker for today, and then we will have some time for the general discussion or for the specific questions that you might have. But let me emphasize that, as I have already mentioned, after this webinar, you will receive the invitation to join the mail out that we have, and we will copy this link again, the link to the questionnaire. Whenever it is convenient to you, you can do this. And now I would like to introduce our next speaker, Dr. Ewa Dobiała, who is a psychiatrist, a psychotherapist, and supervisor at the Polish Psychiatric Association. She is also an international master trainer and supervisor in the World Association for Positive and Transcultural Psychotherapy. She works both with children and adults, and also she works on the community level. She has over 18 years of practical experience as a trainer in the mental health area, and her special interests are related to working with the psychotraumatology in the transcultural field, with adaptation and research, And also she was a trainer and a supervisor in many countries in the post-Soviet areas in Middle East. What is more important, she also actively engaged in the work with the Ukrainian psychologists and psychotherapists and mental health professionals in Poland since the beginning of the war. So Eva, the floor is yours.
Thank you. Thank you for this so big introduction. I would like to share some screen only. Okay. Dear colleagues, thank you that I could also have this few minutes to share our experience, our Polish experience, but maybe also our international experience, which started to be in the very beginning of this war in Ukraine. This war condition open inside of ourselves a lot of questions, what we as a psychiatrist, psychotherapists could really do in this situation of war and such injustice which is just going on. I'm a psychiatrist, psychotherapist, but I'm also very strongly connected with a community of transcultural positive psychotherapists. And because of this fact, I'm in very close contact with our colleagues, psychotherapists, trainers, and supervisors also in Ukraine. At that moment, we've got more than 2,000 psychotherapists in Ukraine and about 200 in Poland. So it was the reason why in the first day of war, some kind of little NGO, new NGO, WAP support project was created just in Poland to think what we could really do with this absolutely new for us situation. In last month, many millions of our Ukrainian neighbors have just crossed the borders and stayed with us here in Poland, sometimes for weeks, sometimes for months, sometimes till this day. We were observing this kind of movement of they coming and coming home. So frankly say, the numbers are really very difficult to say and to count anyhow. But what is for us absolutely more important, we see some kind of dynamic from really very beginning of this war, which is changing every day and sometimes coming back to the beginning and sometimes is going on to the next steps. In the very beginning, in the first hours of war, we were observing really very high levels of anxiety and then a huge level of frustration and all what was around it and what opened the space for all kind of social support aspects and needs in this field. We started to observe also some dynamic of developing PTSD and we really hardly believe that we will see post-traumatic growth in the end of the story. But looking at the condition of us, of mental health practitioners, of psychotherapists, supervisors, trainers, we started to recognize really many levels of needs, which still are in Ukraine, in Poland, and in all countries touched by this war. And these needs we could describe, I could describe a little bit in few dimensions, these dimensions which are really well known by us. This intrapsychic dimension, interpersonal, systemic, family dimension, but also professional dimension as a psychiatrist, psychotherapist, supervisors. At the intrapsychic level, in the really very beginning, it was absolutely amazing how we could observe also inside of us a lot of emotions, inside of us specialists, mental health specialists, a lot of emotions with which we had to somehow be, container, and cope. I remember the first meeting with our friends from Ukraine, psychotherapists and trainers, just third day of war, also in the Zoom, like we are here. It was all absolutely new for us. And this moment where we were talking under bombing condition. We as a psychotherapists, we have never been in this kind of condition before. So we really had to learn how to deal with it, and also how to deal with this all transgenerative aspects, which waking up inside of us also some demons from the past. And really very soon, as mental health specialists, we also had to cope with all these family dimensions, because similar as it was during the COVID, again, we are in the situation in which we try to do all the best for our patients, for our clients, but again, we are in the same situation sometimes as they are. So many of our colleagues in Ukraine, they are still there, trying to do all what they could in this really very difficult condition. And also many of them, as we all know, came to Poland and came to other countries in the world together with their families, looking for some kind of safety, and really need a lot of social support in these first days of their being in other countries. And in this all intrapsychic and systemic dimension, of course, we all were in the situation in which we were still psychotherapists, trainers, and supervisors. And it was a question, how to be psychotherapist, how to be psychiatrist, being in this kind of condition, and what kind of challenges we really meet in this our positions. And we were able to recognize really a lot of it, and trying to use all our capacities which we had as a professional group. We started to create a lot of seminars which were dedicated to some aspects of our professional work in concrete field. So we started to create some seminars connecting with psychosocial games with kids after this all experience, connecting with the process of changing the country with this process of war. We established many seminars where about 500 Ukrainian psychotherapists came to Poland, to Leszno, to my city, where we were able just to sit together and to create some kind of programs, training programs around different aspects which we recognize that it's needed. This process is still going on. Next month, we will have the seminar connecting with sexual traumas. because unfortunately, as a mental health specialist, we need to cope both with psychosocial support and with really very deep decompensations. The compensation connecting with trauma and post-traumatic reactions, but also this kind of decompensation which we could recognize in the terminology of psychiatrical symptoms connecting with depression, psychosis, and so on. The next aspects which we really had to take under consideration was all what has happened in our praxis in the position of supervisors. Suddenly we had absolutely new challenges, this kind of challenges which we hadn't got 1 year ago. Challenges how to work with women after raped, how to work with little boys who came from the war with big traumas, how to work with families, and so on and so on. I will not now maybe tell about all these details, all details about which we know how it is in these war conditions. And because all of it, we had to recognize and really started to take under consideration not only these all challenges which are connecting with new areas of our everyday work, but also all these challenges which are connecting with the difference in qualities of our everyday work. We had to start to create some ideas how to contain our own emotions inside of it, how to take under consideration the risk of mental health decompensation and higher level of suicidality, not only in our patients, but also in psychotherapists who are working under our supervision. We had to take under consideration these all processes which are connecting with the need of separation, our own intrapsychic processes, because quite similar, like in COVID, we are also in this process. We are mental health professionals, and at the same time, we are also in this process. Very often, our Ukrainian colleagues as refugees, or our Ukrainian colleagues like people who are just in this area of war. We also had to take under consideration really a very complex level of mental health costs correlated with different roles in which we are at that moment. As a psychotherapist who have to take care about others, but also about ourselves in this process, and have to just take care about the space which is creating between us and our patients, but also our professional colleagues. And here in Poland, because of the fact that, well, we are very close to this whole situation, but at the same time, not inside, outside of it. We were absolutely aware of the fact that it is really very important to find any solutions, how we could just support our colleagues in Ukraine. So it was why we started to cooperate with every organization who were able to come to Poland and to Ukraine just to support everything what was needed, and the level of needs were absolutely incredible. And it was also why and how we met with International Medical Corps, who helps us a lot and helped us a lot, mainly in making the first conference of psychotherapists and supervisors, which were in August 2022 in Leszno, and which was just about this all absolutely new and so difficult condition in which psychotherapists, psychiatrists, supervisors in Ukraine and countries which are really very close are since the 24th of February last year. Thank you.